I came off the ambulance full time, and I really had to think about it. Like, I contemplated it. I had conversations with family, with my fiance, battling myself because I wasn't ready to come off the ambulance full time. And I thought I would have regrets, but I've been here for a year now in the community paramedicine program, and I love it.
You make changes. They might be small, but small changes add up in the end. And I think if that's something that you're interested in, or just something that makes you feel good at the end of the day, I would definitely join this program.
I think, we'll just be able to better serve a larger population with the services that we're providing now. And we're doing things that no EMS that I know of, or community paramedic programs that I know of, are doing, with the vaccinations, lead draws, shower trailer, these things that are just helping all pieces of the community. It's not just the destitute or the homeless, but it's other folks that, may be okay and living all right, but don't understand their health issues, don't understand their medical problems, don't know how best to, kind of get ahead of it and stay ahead of it. And a lot of what we do is education like that.
Joining the Lancaster EMS Community Paramedicine program as an employee is extremely rewarding. It's extremely rewarding to sit down with patients and see that you have made a long and lasting impact on their life and on their health. Traditional 911 is rewarding in itself because you can potentially save somebody's life. That is rewarding, but there's a lot of times where you don't get to see the follow-through, you don't get to see patients long-term, and you don't get to see the positive health outcomes that you can impact. What I love about community paramedicine is that you are meeting patients where they're at, where they're currently at. You're figuring out where they want to go, and then you're helping them come up with a game plan to get there.
I like having that one-on-one with a patient and being able to follow up with them, as opposed to just dropping them off at the hospital and never speaking to them ever again. A lot of programs in the county are overcrowded, like that's just how it is. So for us to be able to go out and see patients for things like maybe wound care, get social resources in place for them.
I think you have to walk into it with an open mind. I think you have to walk into it knowing that inherently you want to do what's right for your patient, regardless if it is blazing to the hospital lights and sirens, or just helping them learn how to get around their own home, or learn how to get food in the house, or learn how to get their medications delivered, or some of those services that may not be the glorious part of EMS, but I think they're certainly going to be the future, because our whole mission as an EMS provider is to do right for the patient.
What would I say to anybody who's considering joining the program as an employee? Put your application in. You don't necessarily have to be medically trained for some aspects of the community paramedic program, because we utilize a lot of resources that may not be, EMT or paramedic. But if you're an EMT or a paramedic and you're interested in doing a field paramedic program, you definitely want to get your application in. Absolutely.